Just who are the winners and who are the losers in a single-payer healthcare system? In the eyes of Chris Jacobs, what major problems exist in the universal healthcare systems in Canada and the UK? How would, quote, Medicare for all affect wait times and access to treatment, especially for those people who need more specialized care? And what kinds of marketplace distortions or perverse incentives might result? This is American Thought Leaders, and I'm Jekielek. Today, guest host Joshua Philipp, who hosts our new channel, Crossroads, sits down with Chris Jacobs, author of The Case Against Singlepayer: How Medicare for All Will Wreck America's Healthcare System and Its Economy. Jacobs is also the founder of Juniper Research Group. We discuss how, in Jacobs' eyes, Medicare for All would increase wait times, lead to more fraud and corruption, and hurt senior citizens as well as society's sickest and most vulnerable. We also look at how 71% of Americans would actually pay more under Bernie Sanders' single-payer healthcare plan, according to analysis conducted by Emory University professor Kenneth Thorpe.
Chris, great having you on the show.
Thanks for having me.
So tell us about your book.
Yeah, sure. The book is entitled The Case Against Singlepayer, and it's really designed to provide a comprehensive argument for people on the right who have concerns, objections to government-run healthcare, this movement for socialized medicine. There have been numerous volumes written by people on the left to advocate for a single-payer system, but believe it or not, there really aren't that many books that have been written on the right arguing the case against single-payer, why we should not have socialized medicine. So I think this fills an important niche in the marketplace.
I think one of the most common arguments I hear is that, how can we let people get sick and die and they get bills they can't afford? What would you tell a person who thinks that?
Well, I think right now the uninsured are covered anyway. They show up at the emergency rooms, and there are certainly better ways to give them care than that. I think the problem is that single payer will lead to massive economic shocks for our country and will also result in poor quality care. Physicians could leave the profession. They wouldn't want lower pay and more government regulations, lower pay for more regulations. And we've seen in past instances in other countries that have socialized medicine systems, Canada, Great Britain, they ration access to care. The poorest and the sickest patients a lot of times can't get care because government bureaucrats decide based on cost principles who does and does not get treated.
And this is something a lot of people miss, is that if your care costs too much, or if the care you need is too specialized, in those countries you can't get care.
That's exactly right. Britain has a rationing body called, ironically enough, NICE. It's not very, the National Institute for Health and Clinical Excellence. It's not very nice for patients who can't get treatment based on their arbitrary cost standards. And I outline that in the book, how patients end up going without treatment, specialized cancer treatment, cystic fibrosis drugs, all these sorts of treatments because they don't meet a government bureaucrats' arbitrary cost targets.
And now you talked about how it'll cost us more. I know that the cost is one of the big things people talk about.
Sure.
And of course, it's also one of the arguments for single payer that, oh well, we'll subsidize it. It'll come through the government. You'll pay a bit more taxes. It'll be mostly on the wealthy who'll have to pay for it. And in the long run, it's going to get rid of these large healthcare costs. I understand that's not the case, as you explain in your book.
Yeah. There are a couple of problems with that. The first is the induced demand for healthcare. As anyone who's ever been to an all-you-can-eat buffet knows, making something free means you'll want to consume more of it. Now, I don't think people will voluntarily sign up for heart surgery because it's free, but you will see additional demand for healthcare. And even an organization like the Urban Institute, which is a leftist think tank, has said the induced demand for care will raise healthcare costs 16%, and the supply of care won't be able to keep up. In other words, people will want to go to the doctor more for free, but there won't be enough doctors to treat them.
And this is something people talk about, is the long wait times that you end up having.
Correct. You end up having longer wait times because it removes one barrier to care in terms of cost, but it creates another barrier in terms of rationing by government bureaucrats.
Now, I understand that you mentioned in your book something like most Americans will end up having to pay more for health care than they currently do. Could you explain that?
Yeah, Kenneth Thorpe, who's an Emory University economist, worked in the Clinton administration, so again, left of center, said that 71% of households would pay more under Bernie Sanders' single-payer plan in 2016. 85% of households on Medicaid would pay more. Because the thing of it is, people on Medicaid, they already get their health coverage for free. They get no co-payments, no premiums, no cost sharing of any kind. So if Bernie Sanders asked these people to pay even $100 more in payroll taxes or premiums or whatever to fund single payer, they're going to be worse off.
And of course, one of the big points a lot of the people on the right, like more libertarian types, will make is that if you start, the issue with healthcare, at least in some people's eyes, is not necessarily the healthcare itself, it's the high cost of medicine. And of course, single payer would subsidize the high cost of medicine rather than fix it. Do you address this in your book? And how do you go about this?
I talk about this, that we need to, and I'm not saying the status quo is acceptable. It is not. Even the status quo before Obamacare was unacceptable. We need to get the incentives right. The problem in healthcare is that everybody is great at spending everybody else's money. Go back to the all-you-can-eat buffet analogy I mentioned earlier. If someone you want a free shopping spree to go through the stores, you would buy a bunch of things, you would grab a bunch of things that you didn't necessarily need. A lot of healthcare services, most healthcare services are shoppable services. Obviously, not somebody having a heart attack is not going to have a chance to look their web app in terms of finding the best quality doctor when they're in the ambulance on the way to the hospital. But we need to get the incentives right to make sure that patients can be better consumers of healthcare.
And there's also something you mentioned a bit ago about the incentive for doctors to want to go to medical school and go through all this trouble. And I know that in Canada it's even more an issue with, say, specialized surgeons, where, if you need, say, a shoulder surgeon or a hip surgeon, there are certain types of surgeons who specialize in what they do.
Right.
And a lot of times, people only go into those professions because it's a very, very good paying job. It takes a long time to learn. And I know in Canada it's very hard to find some of these people. Yeah,
the average medical school student comes about more than 2/3, almost 3/4 of medical students come out of school with debt. And the median, the 50th percentile, is about $200,000 worth of debt. So they can't afford necessarily to take a huge pay cut, which is what would be on offer under a single payer system, that they would get a huge cut in pay. So you have that problem, that most physicians would get a huge cut in pay. The other problem is, by creating a single payer system, what doctors are paid is going to be determined by government bureaucrats. And I don't think the federal government, we've seen with Obamacare that they couldn't operate a website. They couldn't create a website to allow people to buy health insurance. What makes anyone think that the federal government will know the exact correct price of every procedure, every healthcare service performed for every physician in every hospital across the United States? It's not going to happen. You're going to get more distortions in the marketplace, and as you pointed out, physicians will drop out, they'll go into other specialties, they'll leave the practice of medicine altogether. More distortionary effects from government intervention.
And I think the other big piece people don't realize, which problems you find in countries like Canada under their healthcare system, is that you are not allowed to pay a physician for healthcare. And so let's say that you need an immediate surgery. Let's say there's only one doctor in one place who does a specialized care that you need, and that person's booked up for the next 2 years. You're not allowed to go to another doctor and say, I'll pay you, in everything I have for this care.
Your plan is to come to the United States. A single payer would be one of the worst things for the Canadian healthcare system, because the United States is the pressure relief valve on Canada's single payer system. I mentioned in the book, with a country of about 30 million people, there are over 1 million individuals waiting on waiting lists for treatments in Canada. The average wait is about 5 months. In some specialties, it's even longer. Orthopedic surgery, it's about 10 months. Think about that. you get diagnosed with that you need a hip replacement in January, you'll be lucky if you get the hip replacement by Christmas. That's the kind of problems that you face in single-payer systems. And as you point out, the only other option in many cases is for them to go overseas for care.
Yeah, actually I have a friend who was telling me a story just recently. He had apparently a real bad infection in his foot. Called up his doctor. He said, come in immediately. And they operated on him that night.
Yep.
And I understand this is not something you get in a lot of countries these days.
No, in fact, Britain, and I mentioned this in the book, Britain had to cancel 50,000 surgeries last winter because of the flu. Flu is something that happens every year. We all know that unfortunately, some people don't get their flu shots. They come down with illness. They have to go to the doctor. They have to become hospitalized. But we've seen in the past several years several winter crises in Britain's National Health Service, that the system is so underfunded that a simple little thing like the flu, which we know happens every winter, causes the system to go into chaos. People lying on gurneys in the emergency room for hours and hours and hours on end. 50,000 patients' surgeries postponed, canceled. One doctor had to apologize for third world conditions in the emergency room because of lack of bed space, lack of funding. That's what single payer does.
Well, and of course, a lot of people, they point to the VA as an example of what single payer would look like in the United States. And I have friends who are veterans. They say,
yep,
you go in, you sign up, takes like a year before you can actually go in and actually have some treatment. And even then, you might get initial treatment, and then you're on the wait list again.
I talk about that in the book, and I talk about the scandal in the Veterans Administration, how the VA put people on a waiting list and they hid the waiting list. They had this secret waiting list that they didn't tell anybody about because they felt the need to make bureaucratic targets. And it was a poisonous culture. It's a really harmful culture when bureaucrats feel the need to not just force people to wait months and months and die on waiting lists for care, but then need to hide this fact so people don't find out. It's also a problem that shows that government's not very good at allocating resources. Where were the biggest scandals in terms of the VA? Phoenix, the Southwest. Why? Because the government system has too many hospitals, too many VA clinics in the Northeast, the Rust Belt, the Midwest, not enough down in the Southwest where more veterans are retiring. The population is shifting to the South and the Southwest. It shows that government can't keep up and adapt and allocate resources. It's another indication of why centralizing more resources and power in the federal government will lead to poor quality care.
And this leads us to, I think, another point you make in your book, which is about the issue of corruption.
Yep.
And you argue that this will create corruption. What is the basis of that? What is your perspective?
One basis for that is Bernie Sanders' colleague from New Jersey, Robert Menendez. Robert Menendez was indicted. He was acquitted, but he was ultimately indicted on bribery charges for taking over $1 million in gifts from a physician friend of his. What did he do? He decided to try to get, he called the Secretary of Health and Human Services, a cabinet level official who normally doesn't intervene in this matter, but Robert Menendez wanted to get his friend off the hook on millions of dollars of Medicare overbilling. Ironically enough, the physician, he was convicted on dozens and dozens of counts of Medicare fraud. Will putting more power in the federal government's hands increase? Who doesn't think it won't increase the potential for fraud and corruption? If the government is the only payer of health care, you're going to see more and more people, whether they lobby the government directly or they do under-the-table corruption that Menendez got involved in, try to influence the system to get more money because they're going to be underpaid. So what do? You try to come up with these workarounds. Special interest lobbying, corruption. It's an invitation to more of the swamp. It will put the swamp on steroids in Washington. It might be good for people who live in Washington, but it's not good policy.
And of course, this is an issue we see in just about every socialist or communist country, is that corruption often does become rampant. And this is something that there's a great author, Frederick Bastiat, wrote in his book called The Law. which was that what happens when the people charged with enforcing the law then become in charge of the faculties that could violate the law. Who is then the one who holds people accountable? Now, and I understand you talk about, not just government level corruption, but also within the system itself, doctors taking advantage of it, people taking advantage of it. How does that work?
I think you've seen wide incidents of fraud. I thought it was, in current government programs, Medicare and Medicaid, I thought it was very interesting that the Democrats hosted their first presidential debate in Miami. One of Miami's biggest industries has been healthcare fraud. Shady enterprises created in storefronts, suburban storefronts, for the primary purpose of bilking the government out of money, for billing for services never provided. You see healthy people coming out of offices with $1,000 powered wheelchairs. All these sorts of problems. Medicare and Medicaid had over $80 billion in fraudulent or improper payments last year. And I articulate in the book, if we extrapolate those improper payment rates to a single payer system, you will be talking about $200 to $300 billion a year in fraudulent and improper payments. That's something our federal government can't afford. We as citizens can't afford to have this rampant fraud expand even further under single payer.
And that ties into a very important point, I think, that single payer, we need to address when we look at single payer, which is that estimated costs are not reliable. Where do you put the cap? And then what happens to the healthcare industry if you put a cap on it?
Sure. The estimated costs, there have been multiple studies from the conservative Mercatus Center, the liberal Urban Institute, have put the cost at around $30 trillion. And that's actually an underestimate because Bernie Sanders and Pramila Jayapal, their new bills have actually increased the spending, increased the services in the legislation they reintroduced this year. So in some respects, $30 trillion over 10 years is a conservative estimate. You're right that the problem becomes either we will bankrupt the country by more spending, or you're going to have to put arbitrary limits on costs, and that will reduce access to care. That's a fundamental dilemma that everyone on the left faces.
And we see it in the UK where they just tell people, well,
right,
time to die with dignity.
Right.
We're not going to treat you. You cost too much.
That's exactly right. That gets into the issues of NICE that I mentioned earlier, that gets into the winter crisis in the NHS because of severe underfunding. The Congressional Budget Office wrote about this earlier this year. They didn't give a lot of specifics in their report about single payer, but the one thing they were specific with, Britain's National Health Service has faced severe shortages because of chronic underfunding.
Now, one thing you talk about as well is the idea of the economic shock. Could you explain that?
Sure. So, for starters, physicians and hospitals will get paid less under single payer. That's the only way they can try to bring the costs under control, is to pay them less. There's a study in the Journal of the American Medical Association, a very prestigious journal, earlier this year, estimated that hospitals would see their payments go down by up to $150 billion a year. And that would cause potentially 1.5 million job losses. That's just in the hospital sector. Then you add together the physicians' offices, the nursing homes, all of the other ancillary healthcare services, you're talking about millions of potential job losses. The other economic shock would come from the tax increases needed to fund single payer. How do you pay for a $30 to $40 trillion program? The White House's Council of Economic Advisors said that it would leave each family an average of $19,000 poorer by lowering the United States economic potential. It would have a massive effect on economic growth, because when you raise taxes, there are what is called deadweight losses that the economists talk about. And those deadweight losses are inefficiency because of created by the taxation system. And so you would see huge losses, both in terms of jobs and in terms of the economic impact overall. You would see a less dynamic economy. We would be growing even less.
And I know you also mentioned that this would harm seniors.
Sure.
I know you touched briefly on the idea of Medicaid and how that would affect that. But Could you explain a bit more how this would harm seniors?
Yeah, Bernie Sanders' bill, he calls it Medicare for all. In reality, it's Medicare for none. It abolishes the current Medicare program, and I include the specific language. It's Section 901 of Bernie Sanders' bill that says Title 18 in the Social Security Act, which is Medicare, that goes away, poof. There are over 20 million seniors that are on Medicare Advantage plans. Those are private health insurance plans that seniors have and like. And Medicare Advantage plans have grown substantially in the past 10 years. Those would all go away. So over 20 million seniors, they would lose their coverage. The funny thing is Democrats raided Medicare to pay for Obamacare. Now they're raiding Medicare again to pay for this socialized medicine. Bernie Sanders, people raiding funds from poor seniors, the Medicare Trust Fund, to pay for the benefits, health benefits to billionaires is the kind of attack ad that you would think Bernie Sanders would make of Republicans. In this case, it's absolutely true. They raid the Medicare Trust Fund, abolish the Medicare program to pay for health insurance for everyone, even millionaires, one percenters, billionaires like Elon Musk. That's just awful policy.
And I guess just as a last point, you mentioned a path forward. What do you propose?
Sure, I outlined that in the last chapter of the book, spend the last chapter talking about that. I think we need better solutions on pre-existing conditions. The pre-existing condition provisions, Democrats like to claim that they're popular. In reality, the Heritage Foundation said that they were the prime drivers of premium increases under Obamacare. They've priced millions of people out of the market for health insurance. We need to come up with better solutions for people with pre-existing conditions. We need to get the incentives right, as I mentioned earlier, to try to avoid the dynamic where people are good at spending other people's money, and that's why health costs keep going up and up and up. And then we need to make sure that we have a sustainable safety net and make sure that Medicare and Medicaid do not bankrupt our country for our next generation. We already have $22 trillion of debt. We need to make sure that we have a sustainable safety net for the poor and vulnerable without bankrupting our entire country in the process.
Great. So where can people find your book?
Sure. The book is The Case Against Singlepayer. It's available for order on Amazon or in bookstores right now. The ebook is available for download, and the books will start shipping out in a couple of weeks.
Great. A real pleasure having you on the show. Thank you.
Thanks for having me.